So I'm David Durham. I'm a physician, chief of staff for the Shiprock Service Unit out here in the area, Navajo region, Four Corners, right? Um, Arizona, New Mexico, Utah, and Colorado. How has it been comparatively? Your second part of your question, or your first part of your question, I'll answer secondly. It's been, extremely unique. One of the worst outbreaks of any, virus or bioagent we've seen in anyone's lifetimes, right? And we've seen an extraordinary number of deaths. We've seen the virus decimate the populations up here, move through like wildfire. And I think right now our hospitals are full. We're turning outpatient clinics into hospitals, so that places where you go for sit on the chair and you have that roller paper and people tap your knee with a with a little hammer and they look down your throat. We're turning those little rooms into hospital rooms because we're desperate. People in the hallways overflowing. And people don't realize that I think that it's not just a COVID issue. You don't have a pandemic. When you have one major issue putting pressure on one part of the healthcare system, it makes everything worse, right? So prevention doesn't happen like it should. Heart attacks get seen later while they're in evolution and causing more damage, dying, including death. Strokes in evolution the same. Diabetes aren't as well controlled. People's fault because it's for a number of reasons. Things just start to take longer to connect, and by the time you're connecting, or by the time you're following what people brought in, it's much worse, right? Across spectrum, suicides are going up dramatically. Physician suicides across the country have gone up dramatically. So, to answer your question, it's not like a surprise I'm saying all this. It's just the experience has been, pretty bad. And we're also, having been with the military overseas, we know military is pretty, effective in terms of like operations. We know how to like get down to business and take care of things when we're under the gun. On the domestic side, there's so much bureaucracy, and I think we've become pretty spoiled. And we a lot of times create problems to say and to develop a solution to say developed a solution for a problem. I mean, really, it's like we get our, knickers like all balled up for very, small reasons. And, everyone has these emotional reactions and feelings. And as scientists, we just say that's bullshit. I don't care about your feelings. People are dying. Get your, have a good cry. You got 30 seconds and let's get back to work or you're out. That's where we have to be right now, right? We can't be having these, you listen to people who know what the hell they're talking about. So in domestic operations, it's really hard. It's hard because we're a very, very entitled country. We have expectations that exceed our ability to earn those. We believe, I think, as a population and as a medical system, we quote unquote deserve things. That for what reason? I hate the word deserve. We haven't earned this ability. Not only that, we've ignored it. From spring to now, we've had plenty of opportunity to prepare, and we haven't done an adequate job. Okay, we haven't. And we knew this was coming. We knew our system was going to be a magnitude. There was the actual surge during the fall was going to be 2 to 3 times worse at minimum than the spring. And yet, we're spending all this money on other things, wasting money. And of course, you don't elect the best and the brightest to Congress, okay? And so we just don't. No one that is really bright, they're going to be like you. They're going to go out and they're going to chart some new paths. They're going to do some, incredible things, take risks and be successful. But you're not going to get up and be like, yeah, I just want to run for Congress. So we're also left with a huge vacuum in leadership, really good leadership, right? Because people aren't working together. They have their own, political issues that really are completely removed and disconnected what's going on in the field, right? When's the last time you saw a real leader tour a hospital in PPE, really looking at stuff, or, go into like an ICU? You're not seeing that. Why? Because they're scared. I mean, they're scared of their own shadow most days, and this is terrifying them because it's creating an existential threat to their whole definition of being, which is usually not founded on like real solid, morals and kind of life-given purpose. So that's my opinion. That's my take. It's very frustrating. I'm not one to complain. But, you know, I mean, you're seeing this happen after a while. You want to like, you know, I mean, it's
Yeah. I mean,
start throwing rocks through windows.
and then everyone can, who's, viewing this or who's involved or whatever, can have their own opinions, like politically. But like, can you share some light of like your own experience of like the political, issues, or like what gets in the way, like the Navajo Nation, just like for those like this.
Sure.
Yeah.
Yeah, I mean, a couple things. I think it's you're seeing people not. This is so outside their normal course of operation, right? I mean, most government people are they're very cautious and they don't want to make decisions until they absolutely have to and get a bunch of consensus. But we don't have time for that, right? So this is in their defense, and it's just beyond their even. They don't even know how to exist in this category in this sense of a emergency. Um, on the other hand, we've had some amazing responses. You know, our friend David Lamb and others like him are put their own personal money to help deliver water, to help pay for food, to help with basically folks with food insecurity, with I mean, barely making it. Heat, we're cold. It's cold up here right now. So, you know, paying for heat, wood, things like that, transportation, warm clothes. You know, I had folks show up the other day in shorts. It was like, you know, 28 degrees out. So things like that. In addition, I think the New Mexico's leadership, Michelle Lujan Grisham, the governor, has done great. You know, she's you know dealing with the same thing that we are, right? She understands the roadblocks, but she makes it happen. Our you know adjutant general in New Mexico, Ken Nava, General Nava, has been phenomenal. Like he's 24/7. The National Guard has been just extraordinary. New Mexico National Guard, Arizona National Guard have been great. So we have a lot of like, you know, but the thing is, those that are ready, you have to have a certain, you know, you have to have stuff go through layers of requests go through one chain and come down to the state emergency operations center. And that's just, you know, we're just behind the, you know, we're daily a dollar short, right? We're coming in the sixth inning in a 9 inning ball game, right? And I think that, you know, at this point, if the first time around it's forgivable, right now it's not forgivable anymore. It's completely a dereliction of duty if you're not like getting up and you're moving your ass and trying to get things going to help people. You know, if you're not doing that, then you shouldn't be in the game. You know, go in the stands. That's my opinion. So I think there's been good and bad. I think that we can complain all day and it's easy to do, and I do. I mean, I you know, I'm catharsing right now with you, but I think that from the Navajo perspective, we've had some good responses, and people are willing to step up. We've had tons of folks come to, at least during the first wave. This wave I haven't seen as much. You had Samaritans Purse. You had people just driving. I had a couple of docs just driving that recently retired. One from Kansas just drove in, said, "I want to help." He was like, you know, his family doctor with 35 years of practice. It was awesome. It was like whatever we needed done. We had public health service from the U.S. Health and Human Services come in and just step up. You know, we had, you know, people, you know, lots of people want to do stuff. University of California, San Francisco, we have a great relationship with them, and they sent, you know, intensive care specialists and stuff and teams over. So we have a faculty arrangement with them. Johns Hopkins has been great. They're pioneering the Pfizer mRNA, you know, vaccine study, and they've just been phenomenal. And so we've had some like, and you know, people on the ground, the folks I work with up there, the docs and the providers and nurses and staff, they've just been tireless, using their own whatever, putting themselves on the line every day and staying together. But it's really frustrating because, you're seeing people, at the higher levels of administration in different areas that, they're trying to make decisions in a place where they have no experience, very little concept. So my main kind of, criticism would be let people who know what they're doing, who've been, deployed in combat, deployed to Africa for Ebola, down in South America for Zika, down in, respond to H1N1. Let us that have been there in these situations guide you and take our advice, because if you don't know what you're doing, right, you're not a doctor or you don't know these things. Let's listen to those that have done it. That's not happening enough, clearly, right? So we're not saying we know everything, but what else do you have, right? I mean, you're gonna sit around, you're gonna be like, we don't have enough, like, let's make sure that we inject like identity politics or whatever. There's no room for it. Every time you do that, you you extend the time to get to a real solution, and people die. And those are the most vulnerable: Navajo people, Native peoples, people who are lowest socioeconomic classes, food insecurity, single mom with 3 kids trying to make it. They're the ones that are most at risk, and they're being pummeled because of this. So
Yeah,
I think it's unforgivable at this point. We've been through this one time. We knew this was coming, right? No forgiveness at this point.
so that's what really struck me when I visited you and was driving around the reservation, is like the urgency. And that's, talking to you and even like learning about before the pandemic, your own efforts going out into very remote areas, fixing roofs, and then talking to Water Warriors, who's like a group of like recovering sober Navajo men who are like going out and delivering water to very remote parts, like really talking about like what was already a big issue of like just how people are zoned and how people are like living in very remote situations, and also growing up like with a lot of my classmates having been close friends and then having to live in dorms when we got to high school, and seeing what that did culturally and between us and resentment. That's what initially drove me out there, and then actually driving around during COVID, especially Water Warriors talking about like if they could just have like a large water delivery truck, then they wouldn't have to like shoot the chalks on their own trucks to get to these areas, and like people could come to that. And then like understanding that some places are by a stream, they don't need water as much as they need fresh food, cold storage, so they don't have to eat so much packaged food or have to go so far, especially with the curfew of 6 p.m. during COVID, to get their stuff. And then especially Wi-Fi, kids being able to go to school, teach their parents e-commerce so that they aren't relying on like stores that are
We're
closed
going to go
now.
from latchkey kid to COVID kid.
Yeah, that's true.
Right.
That's crazy. So, I mean, that's how I came up with my architectural partner, these hubs, because they're very basic. They're 2 containers linked by a solar panel that provide Wi-Fi and fresh food cold storage, but then also like massive military like size water tanks, and really being able to be donated those, because like people can't really reach their water sources when they have a curfew of 6, let alone with everything you've already been talking about and
Yep.
all the political like layers that you have to work through, because it's like how can you most immediately solve this without just bags of food or just without like little personal like donations. Or Jose Andres an amazing work with like World Central Kitchen getting bags of food to people. What about huge cold storage, like 4-10 key points on the reservation, or
Well,
huge
if we
water
do it this
storage?
way, we're about to when we release the vaccine, we're going to need cold storage. We're
Yeah.
going to need sub-zero storage, and then you need, these vials, and you're going to need it for a time, because it's going to be by tempo. You're going to give a vaccine initial dose one day, and then 28 days later, you're going to give another one. Think about the logistical challenges we're going to have there on a reservation like this, right? 2 vaccines. So we're going to have to track the people we gave it. And oftentimes there's problems and now there's even more scarcity of resources. So, problems with communications, et cetera, right? You're going to have to make sure that you link that second dose to every dose you've given. We're facing
And
challenges.
yeah, and hopefully Wi-Fi could help with that too. Like obviously.
Yeah.
Yeah. So yeah, like honestly, like time spent with you and really understanding and like driving around Farmington, like really helped me understand just like how remote places are, and also talking to Zol Zoni, who's doing his efforts with Water Warriors, and then like just like that. I can't change like a long-standing like bureaucratic conversation. I can push public funding with private efforts, just like David Lamb is, and with sort of people like him.
And you can mention it, in the mission and stuff like that. The key is I'm not blaming and putting personal blame on, government executives or people I'm not blaming them personally. What I'm saying is that when you're used to, because you start there, there's consequences in when you see these, government folks making decisions. If they traditional in their usual, daily operations without this, pandemic, they did something that was, way outside the lines we're supposed to do, they get in trouble, right? So this is conditioned behavior. We got to push for emergent mechanisms to come down to say, look, when we're in condition, when the HHS secretary or whatever, your area director, we got to push things down to the area to say we're in condition green, condition yellow, condition red, condition 1, 2, 3, whatever. We're going to start. This is what we can do. This is how things can be streamlined. We're going to skip some of the normal steps. Not to say you're not going to go back and get audited, because I always tell people, every time there's an emergency, every time like you're in Iraq and you see, for example, pallets of cash showing up to the commander, there's always going to be an audit afterwards, right? So make sure you do shit correctly. Same thing here. Doesn't mean we're not going to do things correctly, but it's just, you know, we're going to have to we have to lower some of the traditional barriers or traditional steps,
Yeah,
right?
to
The
deal with
problem is they
crisis
may be
management.
buried in legislation. If they're legislated from the national level, from Congress, the only way to do that, right, is to have Congress be able to do it. At this point, you know, I mean, you know, this is something we have to do. And we have to hold people accountable, including Congress people. If they're not getting the job done, vote them the hell out, man. And make sure that you know, that it's like,
Yeah, and that's the one thing we can celebrate is like native vote was so much higher this year. You know,
oh, great.
amazing. Yeah. So, like just looking forward and everything, especially with like having the second wave that you're having and sort of seeing like, you know,
Yeah.
lack of preparedness between first wave and second wave.
I
And
wouldn't
sort of
say
how to
that.
move forward.
I wouldn't say lack of preparedness. I would say inappropriate preparedness.
Okay.
Right? Because there was some preparation. Don't get me wrong. We prepared. In some ways, we did good. I mean, at the level of the operational level, at the field level, we're doctors and stuff. We were, you know, we were like constantly, you know, having discussions about planning, but knowing that we'd elevate these, you know, like, okay, we can go so far, but we need this. We need resource requests. We did a good job with PPE planning, but the real area really is for physical, you know, it's for hospital beds capacity, right? You got to be able to separate people with, you know, that are potentially COVID positive, that are pending testing, but maybe symptomatic, that are true COVIDs for non, because you're going to have this huge petri dish of cross infection going on, right? All these different logistical problems that weren't adequately addressed. It was just like, well, that's a little bit too much. Let's just push that off until we're.
But that really boils down to what you were saying of like needing collaboration and like immediate communication that
The
like
only way to do it.
surpasses, yeah,
That's the only way.
surpasses people's difference. Yeah. Which is what you think like a pandemic really like drives home is like, okay, like set your differences aside, especially like in opinion, and do what you need to do. So moving forward, I mean, especially from we're now into December, outside of just like my efforts or just your efforts, like what do you see, especially on the Navajo Nation, like being like the most critical things needed?
Well, I mean, you know, what we need is what we should have had in place by now. So we are now faced with our hospitals being full. So the normal hub and spoke model we're using. So you have the hubs are the areas that are like level 1 trauma centers and big hospitals, large intensive care units and stuff. So and we have area hubs, right? So small area hospitals would transfer critical and COVID patients to the area hubs, right? Who would then transfer critical and COVID patients on the next level to the state hubs, right? All that's been backed up, right? Volume has just put pressure. So now you have backing up, nothing here, and it goes all the way down. So now you're having area and smaller hospitals now having to take care of much sicker patients. There's no way to transport them because there's no capacity, right? And we got, you know, to West Texas calling Albuquerque for transfer patients, Eastern Arizona. I mean, it's how bad it is. So number one, and then we're going to move to crisis standards of care. So crisis standards of care, there's a plan from Health and Human Services with the Assistant Secretary of Planning and Response, and it came out in the latest one in 2018. And basically it said, look, when there's a disaster or crisis, we are going to move from, and this is like, you know, like shit's really bad. Like, what do you do? And it's terrible because it's battlefield triage, right? You're going to live, you're not going to live. So, you know, chance of you living is so low, we're not going to try. You're going to die, right? So we're not going to, you have a good chance of living, we're going to take you in. The walking wounded, you know, we're going to treat, you know, we're not going to do our normal. And this is going to be good for standards of care because we already over-treat and over-examine anyone, not because we don't know. It's because other people, non-physicians, lawyers, bureaucrats, you know, have really layered this managed care monster and created an over excessive testing and stuff, causing an immense explosion. So this might help a little bit in terms of like that may be a blessing in disguise from this. Hopefully,
it will manage expectations and sets better standards. Yeah. Mm-hmm.
So now we're going to this battlefield triage crisis care. That's my analogy. And so these crisis centers of care means you're going to go from generally what is a patient-centered model is like, how can we help do the best good and what can we do to save this patient or minimize further damage, right? Get this person better, maximize treatment, to now you got to look at the population. Same thing in a battlefield, right? As a medical officer, people coming in, like remember the series MASH, right? Don't watch ER and stuff. That's just all acting. They do some good stuff, but they're just actors. They don't know anything about this. So it's like, you know, you're going from like, okay, 4 different triage levels. You're going to be like, you're expectant, so you're going to die. So we're not even probably even try to bring you into the room, right? You're going to be treated out here, and you're critical, so you got to go in. There's a good chance you're going to make it, and then there's like the walking, folks that have a little minor injury. You're going to be like, hey, go home. Like you have a cold.
Yeah.
This should be
Which is
happening.
probably good. Yeah.
Yeah, we overutilize the ER. People come in at 2 a.m. with a baby with a cough because of our system. And in the old days when my dad was practicing, he'd be like, "You're this is not an emergency. Here's some recommendations. Get out of here. Go home. We'll call you in the morning." Now it's like the person complains and there's this and that. They threaten the lawsuits. We got to give her a $3,000 workup, which is asinine. So this is gonna really put some pressure back to the way things really should be in some ways.
It's like there was like leisure that is no longer there, and there's now urgency.
That's right.
Really requires a change. Yeah.
Leisure, yeah. So that's going to happen, and it's going to change things a lot, and people are going to have a big dose of reality. That's going to happen for the next couple of weeks. We're probably going to see, the parts of Arizona, New Mexico, central Utah, central Colorado, and improve dramatically, sooner. I mean, in terms of like after a couple weeks, I think things are going to plateau and come down. The Navajo Nation is going to stay plateaued for longer. Probably get a little worse before they get better. We're going to see more death, right? Longer hospital stays, and more comorbidities afterwards. People realize this is, the SARS-CoV-2 virus is not like, hey, I got the flu and now I'm over it. Even when you recover, the vast majority of people have trouble like for months after. They can't, run, walk as far. They feel tired. They have lung issues. A lot of them have permanent lung issues. This is not like something you just recover with and bounce back into life, usually. So
I think that's the big thing everyone's realizing too. It's so unpredictable, and it will have life options. Yeah. So, I mean, my goal with this stream as well, this virtual event that brings attention both to my fundraiser and also to like what's going on, is our audience is extended from Dubai to Zurich to New York to Sedona to LA, and that's the various people contributing their audiences, and then also just network. And so if there's one thing that has like driven me so much to like make this my full focus, having lived in New York full time until March and moving because of COVID back to Arizona and the West Coast, it's been that for years I've worked in the fine art industry and had to like really realize growing up in a Native American gallery like how little people know in other places of like what about Native tribe. They see indigenous people as something that they visit in Mexico and Peru to take ayahuasca, or they very much are aware that there's indigenous people here in North America, but they don't know anything about them because they're not taught. So it's not anyone's fault. Different people are taught different things in Arizona than they are in Connecticut. So
they don't have interaction with them because they're all really
yeah. And having half Navajo brothers, like, and really seeing growing up that, like, being so remote, you either often completely neglect your culture because you don't want anything to do with it. You want opportunity to move on, like my brother, and he very much embraces being Navajo now. But he's had that struggle, and he's like really pursued a good profession, but that really took being like, I don't want anything to do with this, or people getting very involved in gang behavior to sort of defend their culture in probably not the best way, because they what else are they going to do? And so that's a whole conversation in itself, but that just leads to a lot of like the misunderstanding or like the lack of knowledge of like what's going on in North America, because we're often very focused on bringing clean water, like resources elsewhere, which is absolutely great too. I commend that work, but I'm hoping to direct a bit more attention here. And so as somebody who works with this so intensely, is there anything, especially with COVID, that like to such a global audience, and ask outside of, I'm fundraising for my nonprofit, and I believe in it, but I obviously don't know the whole scope of it, but it's message that you like really hope to, being very well world traveled yourself, that you'd like really want people to know about now and in general about, where you work and what you do and what you need.
Well, I wouldn't just say that's not, it's not just me. I'm not important. I mean, what's important is that you listen to, doctors are pretty direct, right? We're just going to tell you, most of us just probably have too many opinions, but, in some of our opinions, when it comes to medicine, we don't know a lot about a lot of things, but we know a lot about what we do. We do it all the time, ad nauseum, for decades. So, number one, you take precaution. I mean, I would know that this is something that is not, we're gonna get better with it. It's, people say, oh, COVID's gonna be around like the flu. It's gonna get, people are gonna get, there's gonna be improvement in terms of like what we're dealing with now. We're not gonna be in the same state. Probably next year we'll be, not, we'll be back to almost normal in that sense. However, this is not something that surprised us. Those of us have been in the industry for a while and have understood in epidemiology, like we're overdue for a pandemic. Pandemics are like, it's like fire on the Malibu plains or in, Big Sur. Like that's, building a house on there in some parts is like buying it for 10 million is nuts because you're going to have it's a burn plain, right? You're going to have a pandemic. It happens. It's a natural course of things. It's going to, and this is something that we were expecting. Number one. Number two, don't take things for granted. Let's not take things for granted anymore. Let's not bounce back like 9/11 and now we have these memorials, but everyone's like, well, we complain a lot, right? We're entitled, stop using the word I deserve and stop using the word I earn. I mean, just in your own sense of cognition and, take things seriously. I mean, be respectful of others, be compassionate, but understand that this is something that we have to understand is not the singularity of COVID. What it does is changes the entire matrix and operational effectiveness of our healthcare system. All right. So we need to help. We need to prevent stuff from happening. We need to take care of ourselves and help other people. At the same time, we have to stop, taking for granted what we have. Number one, coming out of this, you're going to have fewer doctors. You might have some new doctors, but experienced doctors, they're going to retire. Some of them died. You have people, so doctors and a lot of doctors out of this are like, it's not like a wonderful career being a doctor. It's noble and stuff, but it's not like you're like, whistling every day to work. It's brutal. There's a lot of, you make a great living, but there's a lot of other ways to make a great living and not deal with the same amount of bullshit. I like being a doctor. I love being a doctor, but that's a fact. Nurses, oh my God, they're getting crushed. You're going to have fewer nurses coming out of this. Okay. And fewer experienced nurses, the nurses you need, right? A lot of them will not be, this huge outflood of things. We need to change our healthcare system dramatically, and that's going to take time, but it's going to get out of this. It's going to take time to get out of this entitled mindset, right? The sense of like, I have to be responsible and I have to understand that, going and bashing on the door of the American healthcare system and being demanding is only going to cause further disruption. So how do I, how can we, individually be responsible and change our thinking about stuff and then be proactive? Don't sit around and expect, help to come. Because if anything teaches you about anything, it's not going to. We're just too big of a population. There's too few of us. You have to be responsible and start learning about conditions and stuff and help direct your healthcare. This is really important. And those are the best patients.
Absolutely.
Don't go in and say, I demand this, and this, because it's like, okay, but, help, be proactive. Change the way you think, because the little details about how we, all that stuff will eventually get sorted out. It's going to take a while. It's like every American major change, it takes a lot of tragedy, and we're forced to the very end, and then we suddenly do something that's pretty remarkable. So that's what I would say. I mean, it's not about me. It's about looking around and saying, like,
what's going on?
You don't think this can happen again?
Yeah, it always has. Yeah. So how can you change your mindset to work with each other and be with yourself? Yeah. Awesome. Yeah. Well, I mean, I very much look forward to like trying to get these out there, and then also like directing any kind of resources that I have available to me to like however it seems most fit to, whatever you guys are working on. But thank you so much for everything.
What is this taking place, this event?
It's taking place.
And they all say I'm doing this, and they all like to they're loquacious about all the things they're all about, but when it comes down to doing something, it's like asking people to move, right? Asking people to move, you might have 3 show up, but those are the 3 that you want.
Yeah, absolutely.
Get stuff done. So you're that, and I really am proud of you.
Sorry, absolutely. Yeah. Well, yeah. And so then also just to support Native artists, my dad shut his gallery last year that it was open 45 years. But so a lot of those artists, like this is why I even started on this. It's like, okay, if I'm not in the gallery in New York, how can I represent the artists that like no longer sell in his store? Like some of them are tech savvy, some of them are learning, and a lot of them have kids, but that's like another point of providing Wi-Fi to the res is like, younger generations can teach older generations e-commerce and then be incentivized to continue the art form.